My name is Doug Corey. I'm a colorectal surgeon here in Davenport, Iowa. I did my general surgery at Brooke Army Medical Center in San Antonio, Texas. I did my colorectal fellowship at the Oxnard Clinic in New Orleans, Louisiana. I've been here at Genzyme Medical Center for nearly 10 years now. I've used SepraMesh for several hundred cases. A lot of times when you go back to do hernia repairs on our patients, they've had prior operations, and so there's a lot of scarring inside. And so when SepraMesh came along, it offered us an alternative. I use the SepraMesh IP because it allows me to put a piece of mesh right into the abdomen without having to worry about getting adhesions between the abdominal viscera and my mesh itself. With the new SepraMesh, the film stays on longer despite manipulation, and I think that contributes to having fewer adhesions form between the viscera and the mesh itself.
My name is Dr. Vincent Sayon. I'm a general surgeon here at Anne Arundel Medical Center in Annapolis, Maryland. I obtained my training from Chicago Medical School and residency at St. Agnes Hospital in Baltimore, Maryland. I've been using the SepraMesh basically since inception here. Typically I use the SepraMesh on the laparoscopic hernia repairs, primarily incisional and ventral hernias. Certainly a big concern with performing these procedures is the complication of bowel or other viscera adhering to the mesh. I've performed over 3 dozen laparoscopic incisional hernia repairs using the SepraMesh. It allows you to place mesh intraperitoneally without the concerns of forming adhesions between either the bowel or other intra-abdominal viscera to the mesh. In that respect, it's been a big change from the conventional polypropylene that's been used in the past.
My name is Dr. Andrew Archer. I'm a general surgeon from Dayton, Ohio. I did a general surgery residency at Grandview and Southview hospitals. I've been in general practice for 3 years, where my specialty is advanced laparoscopic surgery and general surgery. I've been doing laparoscopic ventral hernias for approximately 18 months. During that time, I've used several different mesh products. Over the past 90 days, I've switched over to SepraMesh IP. The benefits are a polypropylene mesh, which is a mesh which will allow full tissue ingrowth to repair the fascial defect. The film, which is resorbable and also forms a gel overlying your tackers, and that gives full protection the entire length of the polypropylene mesh. I've found, in my experience, the anchors are a real source of adhesion formation. One of the benefits of SepraMesh IP is that the film is able to coat or form a gel overlying your tackers or your anchors that are placed to secure the mesh, as well as prevent adhesions to the underlying bowel. So I think that SepraMesh IP is a superior product to be used in laparoscopic ventral hernias. SepraMesh IP has not only the film that will prevent it from sticking from underlying bowel, it has the polypropylene mesh that allows tissue ingrowth to repair the fascial defect.
With SepraMesh IP, it becomes incorporated into the abdominal wall quite well. It has enough memory such that it is easy to put in and position when the abdomen, but not too much memory so it's not too stiff. I think if the mesh is too stiff, you're more likely to get chronic irritation of the abdominal wall and therefore chronic pain. It's soft enough that it's easy to use, doesn't incite a lot of irritation of the abdominal wall that causes pain, but at the same time gives us reliable strength.
The SepraMesh provides a strong, long-lasting repair, and it's a critical component to a long-term repair. The polypropylene is a favorable mesh in that it allows tissue ingrowth and therefore providing you with a permanent, very stable mesh for hernia repair. Another advantage of SepraMesh is its ease of use. Once the mesh is hydrated, it can easily be rolled and inserted through a trocar into the intra-abdominal cavity. At this point, due to its memory, it will re-expand nicely and then is easily placed in the appropriate position. Typically, the mesh is tacked into position after 4-quadrant stay sutures have been applied. SepraMesh can be used for an open repair as well, particularly when there's a large tissue defect that precludes primary closure. In this way, the mesh can be used to close that defect without concerns of adhesions to the intra-abdominal viscera.
My partners and I use SepraMesh because we find that it is easy to work with, it has excellent memory, and gives us reliable results. It's easy to manipulate once it's inside. And once I put it down in the abdomen, it stays down. I'll scrunch it up like this to get it inside the small fascial defect. Once I position it and put it where I want it, it folds back out quite easily. Notice the corners don't turn up despite me folding it back and forth. I can anchor to the abdominal wall quite easily with simple interrupted stitches. SepraMesh IP comes in a variety of sizes that allow us to repair small incisional hernias, but also comes in a large enough piece that we can repair the largest hernias that go from the epigastrium down to the suprapubic region. It's very reliable and a very consistent product no matter what size piece of mesh you have.
When you're doing laparoscopic ventral hernias, you're looking for a product that can help make your procedure easier. Basically, you're looking for a mesh that's going to be user-friendly, able to be manipulated without adhering to bowel. Also something that's form-fitting, or at least you can make to form-fit to each patient. SepraMesh comes in a variety of sizes. However, that does not limit the surgeon to those set sizes. The mesh can be cut to conform to any size that you would want. During my laparoscopic ventral hernias, I use a Hassan trocar, which is a 12mm trocar. That's my camera port. I will also use 2 additional 5mm trocars laterally. Those are where I insert my instruments to help fixate the mesh itself. Rolling the SepraMesh is very easy, and once it's rolled together, grabbing it with a grasper at the one end of the mesh and inserting it through the trocar is very user-friendly, and it's very easy to manipulate and bring to the abdominal wall. One of the important things doing laparoscopic ventral hernias is the selection of your mesh product. It will really determine how well you can do this surgery. SepraMesh IP has all of the components that are necessary to aid the surgeon in having a very successful repair.